Preventing heart disease is often framed as a concern for later life, but the foundation for cardiovascular health is built decades before symptoms appear. In your 20s and 30s, the goal is primordial prevention, stopping the risk factors like high blood pressure or cholesterol from developing in the first place. Many issues that lead to heart attacks in your 50s begin as microscopic damage to the artery walls, atherosclerosis, in your 20s. Blood pressure. Ideally keep it below 120 by 80 millimeters of mercury. Consistent high pressure weakens the heart muscle over time. Cholesterol or lipids. High LDL or bad cholesterol can start depositing in arteries early. Get a baseline screening at least once in your 20s. Blood sugar. Insulin resistance often begins in your 30s. Monitoring HbA1c or fasting glucose can catch prediabetes before it damages your blood vessels. While 150 minutes of moderate aerobic activity per week is the standard, reducing sedentary time is just as vital. If you have a desk job, aim for activity snacks. 5 minutes of movement for every hour of sitting. Focus on quality of fats and carbohydrates rather than just calories. Swap saturated for unsaturated. Use olive oil or nuts instead of butter or palm oil. Fiber is key. Aim for 25 to 30 grams daily. Fiber helps sweep cholesterol out of the system. Sodium awareness. Excessive salt, common in processed foods, is a primary driver of early onset hypertension or high blood pressure. Chronic stress and poor sleep, less than 7 hours, trigger cortisol spikes and inflammation. Over a decade, this contributes to arterial stiffness and weight gain around the midsection, which is more metabolically active and dangerous for the heart. Even if you are young and fit, these symptoms warrant a professional evaluation. Unusual shortness of breath. Feeling winded during activities that used to be easy. Chest discomfort. Not just crushing pain, but also pressure, tightness, or a burning sensation during exertion. Palpitations. A feeling that your heart is skipping beats, racing or flopping in your chest. Leg swelling. Unexplained swelling in the ankles or feet at the end of the day. Have a blood pressure check at least once a year. Cholesterol panel every 4 to 6 years if results are normal. Weight and waist hip ratio. Monitor annually to track visceral fat. Smoking or vaping. Quit entirely. There is no safe amount for arterial health. Family history is a significant non-modifiable risk. If a close relative had a heart attack before age 55 in men or 65 in women, you need earlier, more frequent screenings.